As Vice President Joe Biden said, the passage of a landmark health care law last week was a big deal. Here to talk about it are returning Fred McKinney, economist, Frances Padilla, acting president of Universal Health Care Foundation, a return engagement. We had you guys on months ago. So, okay, this thing passed. It's landmark. It's historic. But at the end of the day, are we going to pay for this thing? How does it get funded? Your thoughts?
Well, it is a landmark bill. It is landmark legislation, and it is going to be very different from what we've experienced in the past. But I think the concern about how we're going to pay for it may be a little bit overstated, because we were going to pay something anyway.
What do you mean?
Well, the healthcare system was really off the track. It was running out of control. And, you know, this bill, one of the main features of it was to insure 32 million Americans. Well, whether those Americans are insured or not, we still pay for them. So now we have a system that, at least in some sort of thoughtful manner, will cover their health expenditures.
Frances, it's been your life mission here, right? Getting this done.
Absolutely.
Your thoughts?
We have been paying, the federal government and state governments have been paying for health care. Consumers, patients, and employers have been paying for health care all along. And we will continue to pay under the new legislation. We're just going to pay more rationally, and we're going to get better value for our health care dollar.
But what does it say, though, when the majority of folks, including myself, can tell you, you know what, I'm still not real clear with all the elements of this bill. I know a few things. They can no longer deny people with pre-existing conditions. That's one key element, right? But as far as process, if folks aren't real clear what's going on, was it a fair and sound process, or was this thing sort of jammed through?
Well, on the political side, there was a political decision that the Obama administration made that this was an important piece of legislation. I think he wanted to have bipartisan participation in it. That didn't work out, and he decided that at the end of the day, he was going to be judged on the success of this politically, and he did, I think, what he had to do. Now, that doesn't sit well and will not sit well with some Americans. But I think when the dust settles, I think that we're now finally over a major stumbling block in the issue of health care. And I think over time, the feelings will sort of die down, the passions. Mm-hmm. And I think in the long run, Americans will be happy that this is finally done.
Recent Gallup poll said that 49%, 49 now say they agree with it. Your thoughts?
Right. I think that what we lost in the debate with all the contentiousness was any attention paid to some of the things that are in the bill that are in fact very good and positive moves in the right direction.
Let's talk about that, the key points. Give me one of your key points. I'll talk about some things that are out there. What do you like about it?
Okay, well, one of the things I like about it is that they did think about the need for people to have immediate relief, to have a sense of something happening right away. It is true that the so-called state exchanges, which will be where competing insurance companies will offer actual coverage to people, don't start until 2014. Mm-hmm. But for people that have pre-existing conditions and who don't have coverage and who have been uninsured for at least 6 months, as soon as this year, they will be able to get insurance through special pools that are being set up. There are about $5 billion in this legislation to help states augment what they call high-risk pools that will allow people here in Connecticut who have pre-existing conditions and currently don't have coverage to get coverage as soon as this year.
How about the small business person saying, wait a second, now I'm reading through the fine print. If I have more than 50 employees, you are requiring me to provide health insurance. Is that an undue burden on a small business person?
There is no requirement. There is no requirement on employers. If an employer, and this is down the line, first of all, what employers get right away, small employers with under 100 employees, they get a tax credit. And in this period between 2010 and 2013, that tax credit will be 35% if they offer to pay for half the premiums, 50% of the premiums.
Well, you're telling me that if they do not have 50, that, because I read somewhere they have a fee, if they did not have provide this, they pay a fee for not having
What
this.
you read is later on, when the exchanges are set up, if you have employees and don't offer coverage and they buy their insurance through the exchange, then you will be asked as an employer to contribute a certain amount of money into the exchange, basically to pay your fair share because your employees are buying through the exchange.
Okay. All right. Fred?
Well, this is a system, and I'll be the first to say that it's not a perfect system.
What's missing? What element's missing?
Well, I think one of the things that's missing, and this was that there are some legitimate concerns about this legislation, and I'm a proponent of the legislation, but one of the things that I think will have to be addressed is the whole issue of containment of cost and the structure of the health industry. I mean, we have a system, first of all, that is still employer-based. I'm not a big fan of having our health care insurance based on employment. If you look around the world at systems, you know, this was a big issue, the single payer, the public option. That was like the third rail. But I think the reality is that that's where we'll end up.
I want to play some opposition, some comments from the Republicans who are saying, you know what, this thing is fundamentally flawed. Get your comments to some Republicans who say this is not right.
And look at how this bill was written. Can you say it was done openly? With transparency and accountability? Without backroom deals and struck behind closed doors? Hidden from the people? Hell no, you can't!
Will politics ultimately scuttle this bill or even water it down more than it is now?
No, I think it's the other direction. I think this was a major step of reform, and I think the American people will be happy with the direction of this reform. I think there will be improvements, and I think the issues that the Republicans raise right now will be addressed. And I think there's a lot of similarity between this and the whole civil rights legislation era. There were a lot of congressmen in the 1960s who were opposed to the Voting Rights Act. There were a lot of congressmen and senators who were opposed to the Civil Rights Act. We look back now with the benefit of hindsight, and those folks were on the wrong side of history.
You got 10 seconds, Frances. On the local front here, Connecticut, I believe, passed a bill last time around that had health care but didn't have the funding. How does this federal law influence that?
Federal reform and sustainment in Connecticut, which is the law that was passed last year, go hand in hand. The sustainment law is essentially a state-run public plan that will be offered to people in Connecticut alongside other private offerings within the exchange.
So they had no
but
funding.
It has, when it becomes law next year, it has to go back to the legislature, and it will go back with adjustments made to fit and meet the criteria of federal reform. And the key element in Connecticut that is really going to make a difference for our economy is that sustainment has major pieces that will help to bend the cost curve, that will improve chronic illness prevention and management and reduce the cost of care in Connecticut while we cover everyone and we give good quality care.
All right, we'll bring him back on again, and we'll talk about the public option, which I'm sure will come back roaring in the next couple of years, right? When we come back, folks, we're going to hear from Hartford Courant columnist Rick Green about Connecticut's parole hearings 3 years after those horrifying Cheshire murders. Don't go away.